In this next lecture, we're going to cover the kidneys and the adrenal glands. And there's a left and right kidney. We'll cover the fascia and the parts of the kidney, the cortex and the medulla and calyces, as well as the renal pelvis that empties out into the ureters. And for the adrenal glands, we'll cover the left and right adrenal gland and the cortex and medulla. The kidneys are about 12 centimeters long, superior to inferior. They're about 2.5 to 3 centimeters thick, anterior to posterior, and about 4 to 5 centimeters wide, right to left, or left to right. They are surrounded by perirenal fat, and they are one of those retroperitoneal structures, and I will list those again on the next page for you, because there is a really good view in Netter's. It shows you the peritoneum and the structures that lie behind that, or posterior retroperitoneal. There's a left and a right kidney, and a couple slides away we'll be able to see both kidneys together, and you will see that the left kidney is generally higher than the right, and that is because of the liver. The thickness of the liver causes that right kidney to sit a little bit lower than the left one. The cortex is this area here on the outside of the kidney. They sometimes call it the outer meat of the kidney. And the medulla are these pyramid-shaped structures here. I also like to think of them as little seashells. They're kind of seashell in shape. And then the calyces are these collecting tubules here for the urine. And they come together at the renal pelvis, and then the ureter exits from there and runs inferior along the anterior surface of the psoas muscle. The ureters are about 25 centimeters long, and in the male they are anterior to the common iliac vessels and lateral to the vas deferens, and in the female you see them lateral to the uterus and vagina. This picture from Netter's shows you most of the retroperitoneal structures. It's hard to get a good view of the duodenum, ascending and descending colon, and how those actually sit behind the retroperitoneum. But the retroperitoneum sits like a layer of a saran wrap almost. You can see this kind of a thin film, and that's the peritoneum, parietal peritoneum. And you can see that the kidneys sit behind there. The pancreas is behind that line of peritoneum that runs along here. The aorta and the IVC. And then, as I said, it's really hard to see exactly how the duodenum, ascending and descending colon all sit behind that, but that is one of the nicest pictures I've seen of the retroperitoneal structures. This image is a bit of a review. We've already gone over the vasculature when we studied the abdomen, but here you can see the left kidney and how it sits just a little bit higher than the right kidney. You've got the left and the right adrenals, these sort of golden colored organs sitting on top of the kidneys. And they don't always sit right on top of the kidney. There's sometimes a little bit layer of a fat in between the kidney and the adrenals. You've got the IVC here and the aorta here. Got the celiac axis and trunk and the SMA. You've got the left renal vein coursing from the kidney into the IVC here, and then the right renal vein here. And you've got the ureters coming down, and they course anterior to the iliac vessels. So this is the aorta and the IVC branching into the common iliac arteries and common iliac veins, and the ureter courses anterior to the common iliac artery and vein. And then those also again branch into the internal and external iliacs. And we'll study this a little bit more when we get into the male and female pelvis. Here we can see some axial views that are at the same level, and you get a good idea of how the structures lie and the vasculature as well as the peritoneum. You can see the parietal peritoneum here running across the front of the anterior portion of the descending colon, anterior to the kidneys, anterior to the duodenal flexure, anterior to the pancreas. And so all of these structures are retroperitoneal, behind the peritoneum, posterior to the peritoneum. So you've got the aorta here, and the IVC, and both kidneys, the pancreas, and the duodenum that are all retroperitoneal. Both kidneys are surrounded by a layer of fat, and this helps to protect and cushion the kidneys, as there's not a lot to protect them. They're just below the rib level, just at the lower level of the bottom ribs and below that. They do have some muscles here to protect them. So here is the psoas muscle on each side of the spine, and the quadratus lumborum, which you'll see more when we study the muscles. This is not one that you need to know for the test, but it's nice to know where it is on an axial image. And the muscles of the spine, several different groups of them here, and those also help to protect the kidney. This fascia here, there's a thin line, thin white line that you can see that wraps around the kidney, and that is Geyroda's fascia. I actually listened to that on dictionary.com to make sure I was pronouncing it correctly, and they say Geyroda's, I believe is how they pronounce that. It's this word up here, G-E-R-O-A, or G-E-R-O-T-A, Geyroda, I believe is how it's pronounced. So this fascia is a nice barrier if there's any kidney disease, that it helps to keep that confined within the kidney. If it does go outside the kidney, it is usually much worse than if it is stayed and protected by that fascia. And then you've got the vasculature, so we're at the level of the renal pelvis here, and you have the left renal vein coursing towards the IVC, and the left renal artery going towards the kidney here from the aorta, and then on the right you have the right renal vein and the right renal artery here. And you can see the same thing, same level basically right here in the CT image. So right renal artery here, and this is the IVC. This may be a little portion of that right renal vein. And you can see the left renal vein coursing across from the kidney over to the IVC, and the left renal artery coming from the aorta to the kidney. And this looks like a little cyst on the left kidney. And the renal cortex, as you can see here, is quite a bit brighter. And you can, as you would see here, this is the renal cortex here. And then you see the calyces are a bit darker in the drawing, and they also appear a bit darker in CT images because the contrast starts to get mixed with urine, and so it's not quite as bright as it is when it's in the kidneys themselves. And then once it goes through the calyces and into the vessels themselves, and I'm sorry, into the ureters, then it becomes quite bright again. The adrenal glands, or suprarenals, have a very similar makeup to the kidneys themselves. They have a cortex and a medulla, and they look similar in their layout to the kidney cortex and medulla. The outer layer is the cortex, the inner layer that sort of looks like a pyramid, or in some cases it sort of looks like a little seashell, is in the center. And the adrenals sit on top of each kidney. So again, there's a left adrenal and a right adrenal. They get their vascular supply off of the aorta here. So you can see the little artery going towards the left suprarenal or adrenal gland, and one going here off to the right. They are retroperitoneal, just as the kidneys are. They are lateral to the body of the spine, and they sit on the upper pole of each kidney. Again, the left kidney and adrenal gland sit superior to the right because of the liver that sits up here and takes up a little bit more room in this portion of the body, the upper right quadrant, and so that right kidney is a little bit lower than the left. When looking at coronal drawings or images of the adrenal glands, the left gland will appear a bit more dome-shaped or semi-lunar, and the right one appears more like a triangle or a pyramid, so they have slightly different shapes. But on axial CT scans, you won't really notice a difference. They appear more wishbone-shaped, and we don't see the left adrenal gland so well here in this image. We're just not getting a very nice slice of it, but the right one is fairly well defined. Looks a little bit like a wishbone. The right adrenal gland lies posterior to the IVC and just lateral to the crus of the diaphragm. And on the left adrenal gland lies lateral again to the crus of the diaphragm, or just to the left of the crus of the diaphragm. And you're seeing the superior pole of the left kidney here as well. This image is of an IVP, or intravenous pyelogram, and they're not as common to do anymore in radiology, as CT has taken over some of the brunt of the work of taking a look at the kidneys and ureters and bladder. But this image, you would inject intravenous contrast, and as it came through the kidneys and down through the ureters and into the bladder, you would compress the bladder to try to keep the contrast in the ureters for as long as you could. So they would wear a belt, I believe, with some pads inside the belt to compress the bladder even more, and that would keep the contrast in the ureters for as long as possible, so that you could see these fill up really well and notice if there were any areas where the contrast wasn't filling. Sometimes that can indicate a stone, and you could see those there. Sometimes it could indicate some other sort of defect or a twist or kink in the ureters. But also there is natural peristaltic motion. So there's a squeezing, a contraction, and a release of it, just like there is in the bowel. And as that urine is squeezed and pushed through the ureters, you sometimes get a break in the contrast, in the line of contrast that comes down through the ureters. And so you can see why, if somebody had a kidney stone and that's being squeezed and released and then squeezed and released, that you sometimes get these waves of pain and nausea. The ureters come down and attach on the most posterior and inferior portion of the bladder, and I will mention this again when we're setting the pelvis. But the ureters attached down there as a way of anchoring them to the base of the bladder. So if the ureters were actually attached to the top of the bladder, and as that bladder got filled with fluid and then released and filled with fluid, those ureters would be, in flux up here, sort of just free floating a little bit up in the abdomen and pelvis. But since they are anchored down here at the bottom, they don't change their length or shape with the filling of the bladder. I had actually mixed up my slides for that last portion of the lecture. I'd had the CT IVP up instead of the traditional IVP. So this is actually a traditional IVP here, and I just wanted to show you that image. In the study guide, it will be correct because I have flipped them back to the correct placements. And here is the CT version. So you can see how this looks very similar to a traditional IVP. They have subtracted out some of the bowel gases and the soft tissue and the ribs up here, but it looks very similar to the image that you saw before. And you can see some of the peristaltic motion again, and how on this one how the ureters come all the way down and attach to the base of the bladder posteriorly and inferiorly. And then this is actually a video, so I was just going to run this for you so you can see a little bit more detail how they can turn this CT scan around and be able to look at it. It's much like looking at 3D netters and or that biodigital